Hello, my name is Georgia Delgado. I am from Catholic University of Santiago de Guayaquil, and today I'm gonna talk about cytokinesis, beta blockers, and congenital heart disease. Let's start with the definition. Cytokinesis. Cytokinesis is the physical process of a cell division, which divides the cytoplasm of a parental cell into two daughter cells. It occurs currently with two types of nuclear division called mitosis and meiosis, which occur in animal cells. The cardiomyopathy. The cardiomyopathy and cytokinesis. Human cardiomyopathy have low proliferation rates during childhood. Approximately 1% of cardiomyopathy give rise to two progenitor cells each year, and usually have a single nucleus, although approximately 20% of the cardiomyopathies in a newborn human have two nuclei, and so are binucleate. The binucleation and multisclination of cardiomyopathies are caused by their failure to complete cytokinesis. Congenital heart disease.
Congenital heart conditions. A congenital heart condition is a problem with the structure of the heart, which develops before a baby is born. The most common congenital conditions include a hole between two of the heart's chambers, septal defects, narrowing of the body's main artery, coarctation of the aorta, narrowing of the pulmonary valve stenosis. These affect almost 1 in 100 births in the UK. In most cases, a problem has occurred during the early development of the fetus. This could be due to a mistake in a gene, but in most cases there's no known cause. Most defects can be detected during pregnancy, but some are not found until a baby is born. Less serious conditions may not be spotted until much later. Symptoms in babies or toddlers can include a blue tinge to the skin, poor feeding, breathing problems, extreme tiredness, rapid heartbeat, excessive sweating, and chest pain. Treatment depends on the individual and the condition. Some only require regular medical checkups, but others may need medication or surgery. There is evidence that some congenital heart conditions can run in families. The BHF is funding research about this.
Applications in medicine. Beta blockers. Beta blockers, also known as beta-adrenergic blocking agents, are medications that reduce your blood pressure. Beta blockers work by blocking the effects of the hormone epinephrine, also known as adrenaline. Beta blockers cause your heart to beat more slowly and with less force, which lowers blood pressure. Beta blockers also help open up your veins and arteries to improve blood flow. Key facts. How do beta blockers work?
Your heart pumps blood around your body through a network of blood vessels, known as the circulatory system. Your blood then supplies the cells in your body with the oxygen and nutrients they need. If your doctor has prescribed you beta blockers, such as atenolol or bisoprolol, it may be because you have an abnormal heart rhythm, or angina, or heart failure, or had a heart attack. Beta blockers work by blocking the actions of hormones called adrenaline and noradrenaline. These hormones make the heart beat faster and with more force. Blocking them makes your heart beat more slowly and with less force, which reduces your blood pressure and the strain on your heart. Before you stop or change any medication, even if you're worried about side effects, talk to your GP first, as changing or missing a dose could harm your health. For more information about beta blockers, visit bhf.org.uk/beta blockers.
Pros and cons. Tetralogy of Fallot. Tetralogy of Fallot with pulmonary stenosis is a severe congenital heart malformation that necessitates multiple surgeries in the first few years of life. The condition involves 4 heart defects: ventricular septal defect, pulmonary vein stenosis, a malpositioned aorta, and right ventricular hypertrophy, and is associated with activated adrenergic signaling in cardiomyocytes and an increased incidence of cardiovascular disease in adults. Main idea: Tetralogy of Fallot as congenital heart disease.
The heart is made up of 4 chambers. 2 filling chambers, known by the medical terms right and left atria, and 2 pumping chambers, known as the right and left ventricles. You may notice that the right side of the heart is on the left side of this video, and the left side of the heart is on the right side of this video. That's because when we talk about parts of the heart, we always use the patient's perspective and associate the parts of the heart with their right and left side. The left heart contains oxygen-rich red blood for the body. The right heart contains oxygen-poor blue blood, which is pumped through the lungs to be filled with oxygen. Tetralogy of Fallot is a condition that is made up of 4 defects. First, there is a ventricular septal defect, or VSD. This is a large hole between the 2 ventricles. This hole allows blue blood to pass from the right ventricle to the left ventricle. This is a problem because this blue blood goes through the aorta, then through the body, without being refreshed with oxygen by the lungs. The second defect is a series of narrowings across the outflow from the right ventricle to the pulmonary artery. This is called stenosis. This narrowing begins in the right ventricle just below the pulmonic valve. The narrowing continues due to thickened cusps of the pulmonic valve and small pulmonary artery. This narrowing reduces blood flow to the lungs, and the hole allows for oxygen-poor blue blood to mix with oxygen-rich red blood in the left ventricle. This blue blood now gets pumped through the aorta to the body, which results in bluish discoloration of the skin, nails, and tongue. This is called cyanosis, and it's where the term blue babies comes from. These babies have an abundance of blue blood and a lack of oxygen-rich red blood. This leads us to the third heart defect of tetralogy of Fallot. Because the heart has to do more work to pump blood through a narrowed valve, the right ventricle becomes more muscular and therefore thickened. The fourth defect has to do with the positioning of the aorta. In tetralogy of Fallot, the aorta is positioned right over the ventricular septal defect, which is the hole between the 2 ventricles. Surgical repair of tetralogy of Fallot involves 1. Closing the VSD, and 2. Opening up the narrowed pulmonary valve to improve blood flow to the heart. If you have tetralogy of Fallot and want to learn more about your condition, talk to your doctor.
Issue applied in Ecuador. Congenital heart disease in Ecuador. In Ecuador, every year, 7,339 children are admitted with a birth defect or other previously accurate complication. 18 patients out of every 10,000 hospitalizations are admitted with a congenital defect. Cardiac defects are the main reason for hospitalization, and cleft lip is the most prevalent birth defect. According to the Latin American Collaborative Study of Congenital Disease data, 1% of all deaths are from congenital malformations, and 36% of these defects were mainly due to cardiac congenital defects. Discussion.
I'm Sanjay Kaushal. I'm the Director of Pediatric Cardiac Surgery here at the University of Maryland Medical Center. I just recently returned back from Ecuador, where we operated on 20 patients who had congenital heart disease. We took 20 medical professionals to Ecuador, and that includes a pediatric cardiac surgeon, a pediatric cardiac anesthesiologist, intensivists who run the PICU, as well as nursing staff who help take care of the patients both in the operating room as well as in the intensive care unit. As you can imagine, this is a big team of professionals that went down there. The trip was sponsored by International Congenital Heart Foundation. This is an organization that sponsors trips to third world countries that are trying to develop programs in order to help patients with congenital heart disease. This organization is very unique in the sense that we just don't go down there just to operate and then fly out. What we try to do is try to educate, teach, and show them how to operate on patients with congenital heart disease.
Conclusion. Through experiments in which they used genetically engineered mice and cultured cardiomyocytes from humans with tetralogy of Fallot also showed that inhibition of beta-adrenergic receptor signaling with the beta blockers like propranolol and alpranolol can be used to increase levels of EC2 and promote the cytokinesis of cardiomyocytes and thus increase the number of cardiomyocytes after birth. Thank you.